The main risk drivers for head and neck cancer are going to be tobacco consumption in any way, shape, or form, particularly smoking, but also smokeless tobacco, as well as alcohol consumption. Those are the two main risks for cancers of the mouth and throat and voice box. For cancers of the skin, the main risk factor, as known, is exposure to sunlight. The most common early symptom is going to depend on the location of the tumor. Grouping them, I will say ulcers of the mouth, open sores in the mouth, difficulty swallowing, neck masses, bumps or lumps in the neck, and of course on the skin, anything that it's an abnormal growth that's grows over time and has been there for a while. Those are concerning symptoms and require an immediate assessment. Early detection is essential to get the best possible outcome. This is true for every cancer, and it's particularly true for head and neck cancer. When you have a tumor that has advanced, that has already spread, it doesn't only affect the survival, but also affects the degree of function that the patients will have after the treatment. So in order to maintain not just the best chances for beating the cancer, but also having the best possible function after the treatment, is very important that we detect them early on. Anytime we have a patient referred to our clinic, we will usually try to get same-day appointments with our radiation oncologist specialist, as well as with the medical oncologist, emphasizing the importance of having a multidisciplinary evaluation that will result in a multidisciplinary treatment recommendation. From there on, it will depend on what are the next steps. Commonly, we'll complement the initial evaluation with additional imaging to see if there's any spread or any additional workup to be done. And subsequently, after our group decision and group recommendation, we will move on with the treatment that may involve surgery or non-surgical management. I have to say that what drew me initially to this specialty is the intersection of the complexity but also function and the self-identity of the patients. So the ability to be able to remove or address a life-threatening condition while preserving function and the patient's self-identity, it's something that I found fascinating.